Welcome to the episode of Doctor Patient Conversation. This series aims to address doubts and fears patients have about common health issues. My name is Varsha, and I'm from Patients for Patient Safety Foundation. Eye is something we all worry about, but we don't always know when to take it seriously. With increasing screen time and aging, many eye problems go unnoticed until they get worse. In this episode, we will talk about common eye issues, warning signs, and how to protect our vision. Today we have Dr. Karthayani, a highly experienced ophthalmologist. She completed her ophthalmology studies at Government Medical College, Mysore, and has been with Zamindar Microsurgical Eye Center for over 9 years. She is a comprehensive ophthalmologist, medical superintendent, and accreditation coordinator. Thank you, doctor, for being here.
Thank you, Arsha. Thank you for the introduction.
A lot of us experience headaches, watery eyes, blurry vision from time to time. Sometimes we often notice drooping eyelids and redness. Since these symptoms come and go and we tend to ignore them, how do we know when they are actually serious and we should seek a doctor?
Today in digital era, there is exposure to screens for all of us, be it elderly people or the little children at home. Everybody has a device of their own and they are glued to it. So invariably, they spend a lot of hours in front of the screen. It's not like before pre-COVID where everybody would go outside, socialize, meet friends. Most of it happens even online, right? So we are prone to a lot of eye strain because of digital exposure. Many a times we experience these symptoms that you mentioned. It could be watery eyes, it could be burning sensation, it could be light sensitivity. So these are some of the common symptoms due to exposure to devices for longer duration. But we should not confuse them with symptoms of droopy eyes or double vision. There could be other problems which are causing these signs. So, what is advisable is when you're using any screen, like Dr. Rose already clearly mentioned, whoever it is, whether it's a grown up or children, they have to maintain a correct posture and limit their screen time, first of all. Go out and spend time outdoors. If you see, even the elderly, they meet their friends over a WhatsApp chat or a video call. So it is really important that we all step outside on a regular daily basis, get some sunlight and look at distant objects. That itself relaxes our eye muscles. Being indoors always, being focused on near objects all the time, doing a lot of near work strains our eyes. So, it is better that if we notice any of these symptoms which are persistent for long duration, to consult an eye doctor.
Thank you, doctor. As you have already talked about a long screen time, so could you please tell us, besides screen time, what other eye problems develop with age? Factors like pollution, smoky eyes, daily eye makeup, and work-related exposure can also affect our eyes.
If you see, many people travel long distance for work. So they may ride a two-wheeler or travel by public transport. So they're exposed to a lot of smoke, pollution, pigments in the smoke and all that. So some of them may notice that their eyes are discolored. So many a times people may, the others who look at them, the friends or family may ask them if they're drunk. It may mimic a red eye. So they may feel awkward to step out with these eye colored, which is little, we call it as muddy conjunctiva or conjunctival melanosis. Sometimes these can be very severe also. These are something that we cannot reverse. So when outside, if they're expected to travel long distance in a two-wheeler or in a public transport, it's advisable, if they're exposed to a lot of smoke, to avoid it. Wear protective glasses if they can, and other measures can be taken. Eye makeup, yes, it is recommended that no eye makeup should be shared. What a person uses should be used only by that person. We always recommend at our hospitals that should not keep trying new ones. A person is comfortable with a particular eye makeup, they should continue to use that, not keep experimenting with new company ones. Though they may be of a good brand, you may be sensitive to them. some of the products in them. So it is not advisable to share, it's not advisable to try too many things around the eyes. And yes, to on a regular basis to clear the makeup before sleep. That is important not just for the skin but also for the eye. The other thing that you mentioned was, yeah, pollution that we touched upon, and the screen time. Yes, that can also make our eyes tired. In turn, end of the day, if you're using the screen for long, like suppose a computer user or an IT professional may feel tired overall because of his eyes being tired because of excess strain. They're sitting in front of the screen for long hours, right? So they may feel tired overall because their eyes are strained. So it is important that precautions be taken for such situations.
We also hear about conditions like cataract, glaucoma, and diabetic retinopathy, but many people don't fully understand them. Could you please briefly explain what are they and how they can affect our vision?
So we'll take one at a time. First of all, cataract. Cataract is one of the commonest eye condition, which can be a reason for avoidable blindness. It is a common age-related change where the crystal clear lens, natural lens in the eye, becomes cloudy or opaque, and this affects the vision. The treatment of this is a cataract surgery. Many a times, many patients believe that eye drops or spectacles may improve vision when they have cataract, but it doesn't work. They will need a surgery. And now, cataract surgery is so advanced that they can even get rid of their glasses if they've been wearing glasses. It is almost like a refractive procedure where they can even correct their spectacle number and get rid of glasses. It is so advanced and the recovery is very quick. So, cataract is a common age related change. And next is glaucoma. Glaucoma is a condition where the optic nerve in the eye is damaged gradually over a period of many years, mainly due to one important factor, which is the raised intraocular pressure. So, this is the treatment of it can be in the form of a simple eye drops, which can be once a day or twice a day. If it is with this, they are following up regularly. Yes, we can have normal vision and no problem whatsoever. But the patient needs to regularly follow up. Glaucoma is something very scary, I would say, because it is called silent thief of sight. A person will not have symptoms if he has glaucoma. So, even more a problem that we need to address. That is why we create so much awareness. Oh, okay. So, that is about glaucoma. It's very simple a treatment if detected early. So, we screen all patients, all adults when they come to an eye hospital. Most hospitals screen them for glaucoma. Whether you ask for it or not, they are checking your eye pressures, they're checking your optic nerve health. This is done basis. Next topic that you discussed, you questioned me about was diabetic retinopathy. India is a diabetes capital, so it is important that diabetic retinopathy screening happens regularly. Again, here, if a person has diabetic retinopathy in an early stage, they may not even have any symptom. So they may say, my sugars are well controlled. I'm able to see clearly. I don't need to see an eye doctor unless I have a problem. No, that is not true. There may be no problem till the last stages when vision loss becomes irreversible. So it is very important that whoever is a diabetic gets a regular eye checkup at least once a year. If there are any changes noted in the retina, then the ophthalmologist will accordingly advise them how often they should do their regular eye test. It is not enough that they just control the blood sugars. They need to do a regular retina evaluation. So this is diabetic retinopathy.
Thank you, doctor, for this easy explanation. Could you please tell us, are there any precaution or preventive measures for each of these diseases?
Cataract, firstly, is an age-related change. So slowing down aging to an extent can help slow down cataract. Also, if a person is diabetic, if they are taking care of their sugars strictly, we can slow down the cataract onset and also progression to some extent. Glaucoma is something that preventing you wouldn't know because we there can be like I said, there are no symptoms that a person will have in glaucoma. So it is important on that a person, if having a family history of glaucoma, does a regular eye checkup, even if everything is normal in one visit. Every year they need to go for a regular eye test. For diabetic retinopathy, strict control of their blood sugars and a regular checkup with their ophthalmologist is very important to prevent diabetic retinopathy and its complications too.
Moving on to the next question. Since eye diseases develop slowly, what early warning signs should we watch out for?
There are certain eye conditions which may have early symptoms. There are certain eye conditions which may not have symptoms. So, first and foremost, every year, one regular checkup, especially in patients, in people above 30 or 40 years of age, is crucial, even if they don't have a complaint with their eyes. That is first. If there are certain symptoms, say, for example, a person is feeling blurred vision, headaches, frequent headaches, um, or if they're having watery eyes or redness repeatedly, these are patients who have to come for a regular eye test. Or if they see floaters, sometimes there can be patients may describe as seeing something like a cobweb or a mosquito in their field of view. When they see a clear background, they may see that there is some object which is moving in their field of view, especially like a clear sky or a white background. So these are situations, or if they notice even a little blurring of vision, they may feel, okay, if I take rest, I may be okay. No, these are symptoms that tell us there could be some changes happening in your eye. So please visit your eye doctor at the earliest.
Regular eye checkups are something many people neglect, especially if they have no obvious vision problems. So, how often should we get an eye checkup done?
Like I mentioned, every year a regular eye checkup is important, especially after 40 years of age, when we may face difficulty reading small print. Many of us may notice that what we could hold very close to our face and read is difficult now. We adjust the distance and read. So starting then, once a year regular eye checkup is recommended for all adults.
Could you please explain about the working professionals? How frequently we should get an eye test done?
So, working professionals, I would suggest once a year, regular eye test, even if they don't have any complaints or even if they don't wear glasses. And if they have any symptoms, yes, they should not neglect it. Never use over the counter medication. Always consult the ophthalmologist. Many a times, instead of tear supplements, they may be given other eye drops in the medical store. First thing they give is a steroid eye drops, which can have long term side effects. They may use antibiotics for simple red eyes. They may just Google search, and everything is easy accessible now. So they have to be careful that they don't do all these. Instead, always consult. There is online consultation also. If they feel their timing is not matching, that they can go meet an ophthalmologist in person. There is online consultation. We do offer teleconsultation services. So it's healthcare is easily accessible now. So people should not neglect, especially when it comes to eyesight and vision. They should take care and go for a regular eye test and not neglect any symptom.
Apart from 20-20-20 rule, what simple habits, exercises, or food help maintain good vision, especially as we age?
Correct. So there is nothing specific for the eye as an exercise. Yes, there are many exercises where they have different, moving their eyes in different direction, rotational and focusing on distance and near. Yes, that can be done. Otherwise, simple, when you step outside the house and take a walk, that itself is enough to relax your eye muscles. When you take a brisk walk, don't think that you're just exercising your, leg muscles or you're exercising your heart, you're doing some cardiac activity. No, it is not like that. It helps relax even the eyes. So simple walk outside is also enough to keep your eyes healthy. In terms of fruits and vegetables, I always tell the children, when parents ask me, can you suggest some supplements for them, or even the grown-ups ask how to keep our eyes healthy, I tell them that eating bright colored fruits and vegetables, what is available seasonal, eat more of them. These are rich in vitamin A. They are very good for the eyes to keep them healthy. So, simple walking, plenty of water, sunlight exposure every day, and eating healthy is good to keep our eyes healthy for long run.
Thank you, doctor, for sharing such valuable insight. Before we end this session, we'd like you to share some key takeaways for our audience. What are the important messages you like everybody to remember about eye health?
Yes, Varsha. So remember, there is easy access. You can Google what your eye problem is and get anxious about it. You have a choice for that, or you can visit the ophthalmologist. Please do not use over-the-counter medication. Do not Google your eye problem. You don't have to do anything specific for the eye. Do not splash water into your eyes. Some have this practice of splashing water into the eyes on a daily basis. No, it's not advisable. Regular outdoor activities for grown-ups and children will keep their eyes healthy, eating seasonal, drinking plenty of water are some things, reducing or limiting screen time. So some of the simple things that one can do to keep their eyes healthy is, if they have an eye condition, go for a regular eye test, visit their ophthalmologist as advised, use the medication if they've been given correctly, never use over the counter medication, never Google your eye complaints and look for solutions. Eating healthy, plenty of water, daily exposure to sunlight, exercise in the form of simple walking is great to go to keep our eyes healthy.
Thank you, ma'am. It
Thank,
was an informative discussion with you.
thank you, Arsha.